Upper cervical care is a radically different approach to healthcare. It's natural, and to fully understand the concept, we want to introduce you to all the players, the body parts, the way the nerve system operates, and all the systems in your body that function so that you can better understand how it works. And you know, upper cervical doctors, their main focus are these top two bones of your spine called the atlas and the axis.
Atlas and axis. They sound very similar, but keep it straight this way. You know the Greek mythology figure Atlas? Holding up the world? Atlas is holding up your world, the brain. Axis is so called because the head and the atlas pivot around the axis.
The remainder of the spine, from the low back all the way up to the mid-neck region, has interlocking joints that limit how far the bones can move. But ironically enough, the atlas and axis, the top two, are not shaped the same way. They don't have the same bony locks, and the segments are held in place by muscles and ligaments. And so as a result, it's a more unstable area, and that's of course what gives us the tremendous amount of mobility we have in the neck area. The problem is, with that increased mobility, it does make us more susceptible to injury in that area.
The part of your nerve system that connects the brain to the rest of your body is called the brainstem, and that controls this healing process, the healing communication from your body to your brain. Now, the trick to this whole system is that the brainstem flows through those top two bones in your spine, the atlas and the axis.
One of the upper two bones in your neck can get misaligned to the point two things happen. One, it actually can squeeze down on the brainstem. When that happens, the normal nerve transmissions and the healing mental impulses that go from your brain to every part of your heart, liver, lungs, kidneys, arms, legs, even back up into the head, face, and neck, those messages can get interfered with. If that happens, then wherever those messages were intended to go will cause that part of the body to malfunction, possibly even shut down altogether. That's when people get sick, disease sets in.
So the main goal of upper cervical care is to remove any interference on that nerve system so that your body can operate at its very best and heal itself from the top down, inside out.
We're not treating you for a certain condition. We're removing interference so that your body can heal itself, get itself back to normal function. Whatever that condition is, it can get back to normal function and you're healed.
Do we as upper cervical doctors, do we treat diabetes? No. Legally, we can't even say we treat conditions, but we treat the body, okay? We correct the cause of the problem. We don't treat the problem. That's the problem with the healthcare system today, is that they spend so much time chasing symptoms, chasing diseases, when all healing resides within you. And if we can just remove the interference in that healing process, then the body will heal on its own. That's what upper cervical is all about.
So you see how radically different this style of healthcare is? You know, the concept is simple, it's completely natural, and amazingly, it can aid in the powerful innate healing and wellness process that your body goes through to combat disease and ailments and any problems that you're having in any part of your body, from the top of your head to the soles of your feet.
There's hope. There's hope for people that have been suffering. There's hope for people that have been sick for years. There's hope for people that have been told there's nothing else that can be done.
Upper cervical chiropractic saved my life.
Upper cervical care can actually help anyone with a nerve system. Nerve system controls your health, nerve system controls function. So whether you're an infant or whether you're grandma and grandpa, or maybe somebody with a condition already present, or that person who is a top athlete who wants to perform better, upper cervical care can really help anyone perform and be at their best.
I've had patients from their first day being born and they had a subluxation, which means that that body was out of alignment, putting pressure from the brain, trying to communicate down, and that baby did need a correction at that time, even though the baby was day one.
The youngest patient I've ever adjusted was 3 hours old. My oldest was 94 years old. It's just awesome working with kids because they respond so quickly. And it's so great to be able to work with a child and know that they're not going to have to suffer the things that other people have suffered throughout their life. To take care of the cause of that problem before it ever happens.
Some people feel that children or infants can't go out of adjustment. And I find about 50% of the kids I check are locked out of alignment. And interestingly enough, we find constipation, we find colicky problems, we find ear infection problems, and all sorts of problems that kids can have. What concerns me is if that child falls and hits its head on the fireplace hearth, or hits its head on the coffee table, something's got to give. And just because you don't see any blood doesn't mean damage didn't happen. And oftentimes you'll find you've got this kid that you're calling it the terrible twos, and it might very well be the terrible atlas that's giving them trouble.
Getting a child checked following birth is one of the most critical times to check a child because the functioning of the brainstem is critical to their development.
All I've ever seen are miracles. Children, older people, with all sorts of afflictions.
Within just a couple of weeks, the pain was gone and never came back. That was 4 years ago. Now, she still comes to see me after her soccer tournaments to get checked because she knows at 15 that when her spine is out of alignment, she's not doing as well. She doesn't play as well. She doesn't feel as good. I love my high school athletes. They are so much fun.
If you could imagine if she would have had the opportunity as a child to have gotten checked, to have had her nervous system checked as a child, before her first symptoms of asthma ever even arrived, before she had hypertension or diabetes, before all those things occurred, if she would have had her nervous system checked, I'm very confident that her whole entire life, the past 20 years, would have been dramatically different. Her potential as a human being and her quality of life would have been very, very different. And so it's exciting to be able to educate people about that so children can have the opportunity and more people can know about it so they can live as healthy a life as possible and not have to be faced with huge obstacles down the road because their nervous system wasn't functioning right for over 20 years.
The mother who brings her son in, 2 months old, screams for 2 hours every night because he has colic. That child is experiencing pain, but also the parents are experiencing pain. It's the anguish of, there's nothing I can do. And they tried everything. And then, after the child is adjusted, sleeps like a baby. That's what I love to see. So every day, I touch people and they feel better. It's so cool.
Amazing.
It is.
You know, one of the coolest things about upper cervical care is that upper cervical care doctors focus on this part of the body, but they see healing all over the body. And so there are so many amazing stories that we would like to share with you. Here are a few.
When we were first married, I couldn't touch Angela's face or run my fingers down her spine. I've always been very proud of how she handled all that pain.
At school, sometimes kids do these posters and they put their hands in paint and they stick their hands on the poster. And she wrote this, it was Father's Day, "Dear Dad," and of course they helped them write this stuff, but it was in painting. "I really love you, I hope you get well." 2 little hands. She knew I was sick. She didn't know why. And I didn't know why.
He's about 7 years old, and since birth, he's been paralyzed. The whole half of his face completely paralyzed. And the doctor said, there's absolutely nothing we can do. You're gonna have to live with this for the rest of your life. He started under care a couple months ago, and now he has a crease on his inside of his lip when he smiles. He can smile with that side of his face, and he's starting to be able to move the upper part of his eyebrow and eyelid. So it's amazing.
So I got off the table, and for the first time, my low back pain was gone. My neck and shoulders it was just like somebody just untwisted a tight dish rag or something, and it just dissipated. And then Michael said, well, take a couple of steps. So I took a couple of steps, and my legs weren't tingling yet. And because I had, I guess, neuropathy, I think is the name of it, but anyway, the tingling. And I took a few more steps, and it didn't. And so I said, well, why don't you, walk out to the mailbox? Because I hadn't been able to go out to the mailbox, which was only about, 20 or 30 feet?
20 feet, yeah.
So I put on my tennis shoes, and I walked out there, and I kind of just kept going. I walked a mile. So, the next day, I go off to work. I'm in my skirt suit, my heels, carrying my briefcase, the whole thing, walking the 3 city blocks to get into the office. Nobody has a clue. I meet everybody, go through the orientation. No one has a clue that I was like almost immobile for the year before that.
She's dragging her left leg, walking with a cane. Okay, so we x-ray her, adjust her on Thursday night. Saturday morning, she came back into the office to be rechecked. No cane, and lifted her leg up. And I looked at her, and I said, what happened? It blew me away, so to speak. And she says, that's not all of it. You had me lay down for 15 minutes. I have people rest after an adjustment. After I got up, I went to the car, and I put my leg in the car without any help or assistance. That was 20 minutes later. She'd been walking with a cane and dragging that leg around for 6 years. You see why I won't retire?
And I could hear everything. And the ringing stopped. And my back's feeling much more relaxed. I don't have any pain, and tingling stopping. And I got home and I ate something, and it was hardly in. I still had a bit of pain, but there wasn't excruciating pain. It wasn't driving me over. But I was very careful not to use the jaw too much. But I was so happy that I picked up my daughter, Holly. We danced. I had like this until, I think it was like 3 o'clock in the morning or something like that. And then she was asleep. I took her up to bed, put her down, and I crashed out. And I don't know, I think it was 12 hours, 15 hours, I'm not quite sure. It was a long time. And I woke up and I felt I was a 21-year-old again. And I'm looking in the mirror, and my head's not like this anymore, it's like this.
I have a patient who has cerebral palsy, and a 13-year-old boy. When he first came into my office, he's had multiple surgeries on his arms and legs because his bones were twisted. And when he first came into my office, his right foot flared out, almost horizontal compared to the left foot. The next time he came in to see me, his foot was almost parallel to the other one. The next time, 3 days later, he came in to see me, his foot was almost parallel. And what he cares about, he's running faster. His teachers report that he's doing better in school, and I mean, it's changed his life.
She came in 2 weeks ago and had this smile on her face. And I asked her, I said, what's going on? And she looked at me and said, I'm pregnant. I said, you're pregnant? That's amazing, congratulations. I said, how long have you been trying? And she turned and looked at me with a real straight face and said, I've never been on birth control. We just never thought I could get pregnant, that I could conceive. And then she turned to me and said, I know it's been being under this care. I know upper cervical specific care has changed my life, has allowed my body to function the way it's supposed to, and given my body then the ability to function properly so that I could then conceive.
There was a 10-year-old boy who, his sister and his mother and father are real good patients. And last Thanksgiving, Thanksgiving is Thanksgiving, you say thanks. The family gets together and grandma is there and they're all holding hands at the table and they have to say, what are you thankful for? Each person. It came to that 10-year-old and he says, I'm thankful for Dr. Kuhn. And it isn't just me, it's recognizing that he has his health. He could come in with a flu or a cold and get adjusted and the next day be fine. And he sees his other kids in the classroom all sick and whatever. And he was smart enough to say, I thank you for Dr. Kuhn. I really appreciated that.